You probably clicked this because you've asked, why in the world does America not have universal healthcare? The expected answer is costs too much, right? Well, we're about to blow that up, because the real reason has less to do with money than with power. By the end, you'll see how a system built around profits, influence, and political inertia actively fights reform. You'll also see where a real path forward could live. Chapter 1: The myth we all accept, most people believe, it's just too expensive for America. We repeat, look at Canada, look at Europe, they pay more taxes. That's what the status quo narrative wants you to believe. But here's the twist. The cost argument is more of a political weapon than a fiscal truth. Let's flip it. In America, we already pay a lot per capita for healthcare, far more than almost any peer nation. Yet we get mediocre outcomes. Why? Because a huge slice of that spending goes into overhead, marketing, insurance profits, and waste. If we stripped out those excesses, a universal system might cost less, or at least no more than what we already pay. But that would destroy entire business models. We'll return to that. Chapter 2: The profit machine, insurance, pharma and private hospitals. Here's where it gets juicy. The healthcare industry in the US is a multi-trillion-dollar machine. You have private insurers collecting premiums, denying claims, employing armies of adjusters. Pharmaceutical companies setting sky-high drug prices. Hospitals and clinics operating margins, billing offices, profit centers. When profits are baked into every layer, universal care is not just inconvenient, it's existentially threatening to those businesses. Imagine telling a big insurer, hey, you know all that revenue you make by denying claims or ignoring fine print. It's gone. They'd fight hard, and often they do, through lobbying, campaign contributions, legal challenges. Chapter 3: Politics, lobbying, and why it can't pass. You'll hear, well, the public supports universal healthcare, but Congress is broken. Yes, that's part of it. But why exactly is Congress so paralyzed? Because those same industries have staffed Congress with their former execs. They pour millions into elections. Healthcare bills routinely get weaponized in debates. Socialism, rationing, government takeover. These terms are scare words, effective because they distract you from the real question. Who loses power and money if health becomes a public good? Also, the US Supreme Court has struck down or limited expansions before, citing constitutional arguments about individual mandates or Commerce Clause or states' rights. Each time reform edges forward, structural checks push it back. Chapter 4: Lessons from other countries and the surprising catch. Let's look at what countries with universal systems do right and where they struggle. Canada, universal coverage but long wait times. UK NHS, strong primary care, political battles over privatization, funding crises. Germany, Japan, hybrid public-private models, regulated markets. These examples show universal healthcare is not flawless, but the choice of a public safety net changes the incentives. In those systems, cost containment, negotiating power, and prioritization of preventive care are central. In the US, the incentives favor overtreatment, profit margins, specialization, and fragmentation. Chapter 5: The hidden structures that reinforce the status quo. These are the less talked about mechanisms that entrench the system. Employer-based insurance, it ties coverage to jobs. That means any reform threatens to disrupt millions of employer plans. Fragmentation across states, each state has its own rules. Medicaid is state-federal, complicating a national system. Regulatory complexity and licensing. Layers of bureaucracy make centralized reform feel impossible. Public perceptions and fear. If we hand control to government, it will get worse. That narrative is powerful, regardless of data. One of the biggest surprises: many anti-universal voices are not ideologues, they are health professionals, small insurers, consultants, who see their industries threatened. Alright, I've walked you through the context and the battles. Now here's the jaw drop. The single most decisive reason America doesn't have universal healthcare is a coalition of interests actively blocking it even when citizens support it. And the longer we wait, the more entrenched they become. Chapter 6: The real obstacle. Entrenched power and path dependence. This is your best point, because it's not just money or politics, it's path dependence. Once a system grows complicated, self-reinforcing, supported by countless stakeholders. Changing it becomes nearly impossible without catastrophic disruption. Every doctor, lawyer, insurer, consultant, billing firm, pharmaceutical marketer, hospital executive has something at stake. To shift it means forcing them all to lose or transform. That's hard. That's why incremental attempts fail. They meddle at the edges, threaten the core, and get killed. A bold shift to Medicare for all or a national single payer threatens too much too fast. So instead we get piecemeal reforms, patches, compromises that preserve profitable inefficiencies. Hence, we march toward the same broken horizon. Chapter 7. Could it still happen? Paths forward. If America did build universal healthcare, here are possible approaches. Single payer, Medicare for all. Pros: central negotiation, simplicity. Cons: political death sentence, transition shock. Public option plus strength and regulation, picks at edges, tries to make private insurance compete. Incremental universalization via Medicaid expansions, state-level models, bottom-up approach. Hybrid regulated market like Germany, Japan, public baseline plus optional private plans. Each has trade-offs, but the magic key is political will plus coalition shifts plus public pressure. Until the public sees itself as rights holder rather than customer, change struggles. So here's what you walk away with. The cost argument is half a smokescreen. The healthcare industrial complex has a vested interest in keeping things messy. Political power, lobbyists, and structural inertia block reform. The real fight is over who loses control, not who pays more. But yes, pathways still exist if people demand them. It's tempting to feel powerless in this system. Don't. Your voice, your vote, your pressure matter, especially when you start naming who benefits from brokenness. If you liked this, hit that subscribe button. Leave a comment. Which truth bomb surprised you most? Click next. How Canada really runs its healthcare system. You'll want the comparison. Thanks for watching Unpacking America, where we flip over the rocks you didn't even know existed.